welcome back to my channel.
Novel coronavirus? What is it? What are the signs and symptoms? What can you do to prevent getting infected? Should you be worried about this right now? In this video, we will answer commonly asked questions about the new coronavirus that you may have seen on the news or social media. Hi, I'm Dr. Laura Leyton, and on this channel, we answer your medical questions, debunk myths, and discuss ways to help you live your most amazing life. Always from a real doctor, and always evidence-based with the most up-to-date science. Y también en español. Coronavirus is a large family of viruses. They can cause severe respiratory diseases and also minor ones like the common cold. The coronavirus in the media is a new version of the virus. It was first found in humans in Wuhan, China in late December of last year. It is referred to as novel coronavirus or 2019 N Co Vee, pronounced N Co Vee. It is a new strain that has not previously been found in humans before 2019. We refer to this type of virus as zoonotic. Think like a zoo, because it originates in animals. Similar coronaviruses caused the Middle East Respiratory Syndrome, MERS, in 2012, which came from camels, and the Severe Acute Respiratory Syndrome, SARS, in 2003, which came from civet cats. The Wuhan coronavirus originally came from a live animal market, but the exact animal is not known. Why is it called coronavirus? When you look at the virus under very powerful microscopes, you can see it kind of looks like it has a crown. Corona is Latin for crown, and it's a virus, coronavirus. What are the signs and symptoms of the novel coronavirus? The most common signs and symptoms of the novel coronavirus are fever, cough, and shortness of breath. Other signs and symptoms include runny nose, muscle pain, fatigue, headache, and phlegm. The signs and symptoms are very similar to the flu, just like with the flu. Older adults and people with pre-existing conditions like diabetes, cancer, and heart disease are more likely to get infected. Complications from the novel coronavirus include pneumonia and ARDS, which is inflammation of both of your lungs. Your lungs are made up of small sacs called alveoli. In ARDS, the alveoli fills up with fluid, which causes them to collapse and makes it hard for you to breathe. How does novel coronavirus spread? Novel coronavirus spreads a lot like the flu. Droplets of the virus go into the air when someone who is infected coughs or sneezes. The virus droplets can survive up to 5 days. If you come into contact with a virus droplet when you touch your face, your eyes, or your mouth, the virus can infect you. The virus can take between 1 and 12 days to make you feel sick after you have come in contact with it. What can you do to reduce your chances of getting the novel coronavirus? Cough and sneezes spread diseases. As of February of 2020, there are not many known cases of novel coronavirus in North and South America. Again, just like with the flu, it is very important to wash your hands regularly with soap and water for at least 30 seconds. You cannot trust hand sanitizer ever. Avoid kissing or hugging people who might be sick. And for now, it is better to skip the handshake. Is there a vaccine for the novel coronavirus? No, at least not yet. Scientists around the world are hard at work, but so far have not developed a vaccine. How do you treat the novel coronavirus? Right now, there is no way to cure the novel coronavirus. If you think you might be infected, especially if you have been to China or recently in contact with somebody who has been in China, please go to the local urgent care, make an appointment with a primary care physician, or go to the nearest emergency room. Novel coronavirus and the flu have similar symptoms. Right now, the CDC laboratory tests are the only way to tell if you have the novel coronavirus or not. wearing a surgical mask, taking vitamin C supplements, or drinking herbal teas are not a good way to prevent or treat an infection with the coronavirus. Medical and surgical masks are recommended for healthcare professionals and people who have symptoms to reduce from spreading the virus. They will not keep you from getting sick. Can I get coronavirus from things made in China? No. Items made in China will not infect you. Coronavirus do not survive for a long time on objects. Can you get coronavirus from your cat or dog? Don't worry. Your cat or dog is not going to get the virus or give it to you. So please, do not buy masks for your pets. Should you panic? No. It is important to stay informed. Trusted sources include a healthcare professional, the WHO, and the CDC. The media and social media are not the most reliable sources for health information. If you have a question, it's always best to ask your doctor. If you have questions about the flu or the flu season, check out my other video. If you found this video helpful, please share with your loved ones and friends. Leave your medical questions in the comments down below. And remember, if you cough or sneeze, tap that please. Hasta luego, amigos.